Are your legs trying to tell you something, and you're not listening? Blocked arteries in the legs might sound harmless, but they could be an early red flag for heart disease or even a future heart attack. These signs often go ignored until it's too late. So today, we're talking about the 8 warning symptoms of peripheral artery disease, PAD, and why you should never brush them off. Let's begin. Number 1. Numbness or weakness in the legs. When blood can't flow freely to your lower limbs, you may feel numbness, tingling, or weakness. It can happen even when you're resting, and it may feel like your legs are falling asleep without a clear reason. Example: you're watching TV or sitting at your desk, and your foot keeps tingling or feels like it's buzzing. That's a sign of poor circulation. Number 2. Leg pain. While walking, that gets better with rest. Do your calves hurt when you walk, but feel fine when you stop? That's not just muscle fatigue. It could be a condition called claudication. It happens when blocked arteries can't supply enough blood to your leg muscles during movement. Example: you go shopping or climb stairs, and suddenly your legs feel tight or crampy. You sit for a few minutes, and the pain disappears. That's a classic red flag. Number 3. Cold feet, especially one colder than the other. If one foot is noticeably colder than the other, it could be a sign of restricted blood flow. Warmth in your limbs depends on healthy circulation, and when that's blocked, your feet can lose warmth. Example: even in a warm room or under a blanket, one foot stays cold while the other feels normal. That could be more than just poor circulation. It may be PAD. Number 4. Sores or wounds that heal slowly. Your body is usually pretty good at healing small cuts, blisters, and wounds. When you get a minor injury, your body works quickly to repair itself. Blood flow brings oxygen, nutrients, and white blood cells to the area to help it heal. But if you notice that your sores or wounds take much longer than usual to heal, it could be a sign that blood isn't reaching that area properly. Blocked arteries can cause peripheral artery disease, PAD, which slows down blood flow to your legs and feet. This means the tissues in your legs and feet don't get the oxygen and nutrients they need to heal quickly. As a result, small cuts or ulcers can linger for weeks and become infected, leading to more serious complications. Example: let's say you accidentally scrape your toe or get a blister from your shoes. Normally, this would heal in a few days. But if the injury doesn't heal, gets more painful, or starts to look infected, it might be a sign that blood flow is restricted due to blocked arteries. You might even notice that the wound stays red and inflamed or doesn't improve with creams and bandages. This situation should not be ignored, as untreated wounds can lead to more severe health issues, including gangrene or infection that can spread. Number 5. Changes in skin color or texture. Healthy skin gets its color and texture from a constant supply of oxygen and nutrients carried through the blood. When blood flow is restricted due to blocked arteries, the skin on your legs and feet can show noticeable changes. You might see that your skin looks pale, bluish, or even reddish. Some people also notice their skin becoming unusually shiny or thin, which can be a sign of poor circulation. If the skin on your legs feels dry, cracked, or scaly, that might indicate that it's not getting enough nutrients. When there is less blood flowing through the veins and arteries, your skin doesn't get the hydration or oxygen it needs to stay healthy. This can also cause other problems, like skin ulcers or rashes. Example: imagine you sit for a long time at work, and when you finally get up, you notice one of your legs is noticeably darker or has a reddish tint compared to the other leg. This color change may be especially noticeable when you've been sitting for a while, as blood can pool in the lower limbs and make the skin appear abnormal. If you consistently see this happening, it's time to talk to a healthcare provider to check your circulation. Number 6. Hair loss on legs and feet. Hair growth depends on healthy blood circulation. Blood carries the necessary oxygen, nutrients, and hormones to hair follicles, allowing them to grow and thrive. When your arteries are blocked, circulation decreases, and that affects your body's ability to nourish hair follicles. As a result, You may start noticing thinning hair or even bald patches on your legs, feet, or toes. It's especially important to pay attention if you suddenly experience patchy hair loss on your legs or feet. Normally, hair on the legs and feet grows steadily, but when circulation is compromised, the follicles may stop producing hair, leading to thinning or bald spots. Example: imagine a man in his 50s who's always had full, healthy hair on his legs. One day, he notices that one of his calves looks much smoother, with patches of skin that have no hair at all. He hasn't shaved these areas. The hair is simply gone. He might assume it's just a natural part of aging, but this could actually be a sign of reduced blood flow due to blocked arteries. If you notice this sudden hair loss, don't brush it off, as it's a subtle sign that something more serious may be going on with your circulation. Number 7. Pain in the feet at night. If your feet or toes hurt at night, especially when lying flat, it could be because gravity isn't helping blood flow. This type of pain often gets better when the legs are dangled off the side of the bed, allowing blood to move downward more easily. Example: you wake up in the middle of the night with aching feet. Sitting up or hanging your legs over the edge eases the pain. This could indicate advanced PAD. Number 8. Weak or absent pulse in the feet. Doctors can usually feel the pulse in your feet during a physical exam. If the pulse is weak or completely absent, it means blood isn't reaching your lower limbs the way it should, and that's a serious concern. Example: during a routine checkup, your doctor checks your foot and says they can't find a pulse. That's not something to ignore. Peripheral artery disease isn't just about the legs. It's a serious sign that your entire circulatory system could be under stress, including your heart and brain. If you recognize any of these symptoms in yourself or a loved one, don't wait. See a healthcare provider. With the right tests and early treatment, you can protect your limbs, your heart, and your life. Your legs may be trying to warn you. It's time to listen and act.